Hey everyone, if there's anyone listening, welcome to my YouTube channel. This is probably my first video. My name is Syed Haider. I'm a physician and I've been treating, the C word for about 2 years now online, primarily at mygotodoc.com, also drsyedhaider.com. Some of you may know me from Dr. Mubin's shows, and I've been on with a number of other people talking about what I've been doing this whole time. One thing that's really bothered me is that based on the data that we have from VAERS, from Medicare, from the Department of Defense, from insurance, from the insurance industry, I'm pretty confident in saying that there are tens of millions of people in America who are suffering from long haul syndrome. And not only that, but also injection injuries, which have a very similar presentation. So, I think this video is primarily designed to get the word out if possible. Please like it, subscribe, spread this video, share it with your friends and family, with your doctors, with your congressmen, with everyone, because the main problem that I see right now is that, again, we've got tens of millions of people suffering with long haul syndrome and they don't know what's wrong with them. Most of them don't have any idea what's wrong with them, and their doctors also don't know what's wrong with them. So if they go to their medical practitioner, they they basically get like $1 million workup and then get sent home with some diagnoses, like, which are basically labels, labeling their symptoms for them, and they don't. Your doctor kind of has a big blind spot in with regards to what may be going on. Whether it's from an injection injury or from a sequelae of having been infected with a virus in the last couple of years. So, so I want to kind of explain what I've learned about long haul syndrome, what it is, what causes it, how to diagnose it, and how to treat it. And so let's just jump right in. So long haul syndrome is a chronic syndrome. It's basically a chronic inflammatory syndrome that is caused by the protein that's on the surface of the virus that's been going around the last couple of years. So that little spiky thing that's on the surface. So the S1 subunit of that protein, of the spike protein, triggers these chronic inflammatory symptoms. And so you can get it from being infected by the virus. You can also get it in an injection. So either way, you're being exposed to the spike protein, or the S1 subunit of the spike protein. And so the S1 subunit of the spike protein is what causes the acute symptoms of an infection or injection reaction. So you can have chills, fever, you can have body aches, you can have loss of taste, smell. All those things are from that acute inflammation. And then maybe 1 out of 2 people get over it. Their body clears out the spike protein and they're fine. They go about their lives, they're fine. The other 50+% of people, we have varying estimates of how many people have or end up with long haul and injection injuries. And the estimates vary from anywhere from 10% up to 90%. And so I think it falls somewhere in the middle there. It depends on how you define it. But let's go with 30 to 60, 70% of people will not be able to clear out the S1 subunit of the spike protein. So Dr. Bruce Patterson of InCellDX has done some work on this. He's done some research, he's published some papers, and he's really the only one who has developed a test that can diagnose, basically, that can show the inflammation that spike protein is causing. And he has also developed a test looking for the spike protein itself. So people who come to me with long haul syndrome, um, if I run that test from InCellDX, it's called the InCellKine panel. You can find it at covidlonghaulers.com. And I'll put it in the description of the video if I can figure out how to do that on YouTube. Um, and and so if you run that panel, you'll find a pattern of inflammatory markers, and different kind of, some of them will be up, some of them will be down, and if you create like a ratio of some of them, you can basically diagnose this syndrome in those patients. And you can also see that they are still holding on to the S1 subunit of the spike protein. They hold on to it inside atypical monocytes. Okay, so um, it's a certain subset of monocytes that our immune system normally creates, and these monocytes hold on to the spike protein in people who have persistent symptoms, either after a viral infection or after an injection. And so, what kind of symptoms do people have? So commonly there are, it's kind of a constellation of symptoms or a pattern of symptoms. When you see it, you're like, this is probably long haul syndrome or a vaccine injury, or an injection injury. Um, and But there's a lot of variation within the pattern. So the main pattern that I see will be usually chronic fatigue, some brain fog, um, and and then the other symptoms are kind of variable, but you oftentimes will see anxiety or depression, insomnia, trouble sleeping, or like a specific pattern of insomnia where patients wake up at like 3 4 a.m and then can't get back to sleep very easily. And I know this really well because I had that symptom, and I had long haul syndrome, and I had it for months, this was after I got the initial um, viral infection in probably February of 2020, very early, and the entire course of things. And I, at that point, I didn't know what it was, but and then so I had a lot of other symptoms as well. So other symptoms can include your heart just starts racing suddenly, and you kind of like attribute it to anxiety. You feel like you're anxious. um, when I would lie down in bed at night to go to sleep, my heart would start pounding, in my neck, and I couldn't get comfortable. People have numbness, tingling. People have like a buzzing sensation under their skin. That's a really typical one that maybe not typical, but it's a really pathodomic, what we call symptom, which really, like when you see it, it points to that disease, and it's really specific for that disease. You don't usually see it in other symptoms or syndromes or other diseases, so it's sensitive and specific for long haul syndrome. A lot of people complain of ringing in the ears, and it can be severely loud, really, really bad, to the point where people can't think or sleep or even work, and it can be quite infuriating, and depressing for some people. I mean, people have literally committed suicide from the severity of long haul symptoms. Other symptoms can include digestive upsets, shortness of breath, chest pains, things like that, and allergy type of symptoms. Mast cell activation syndrome. A lot of physicians think that mast cell activation syndrome is long haul syndrome, or like a flavor of mast cell activation syndrome is basically the cause of all long haul syndromes. And so people can have other allergy type of symptoms, runny stuffy nose, other allergic reactions to foods that they never reacted to before. And so that those are like a sampling of some of the symptoms that people have, and they can run the gamut from mild, moderate to severe. And so, some people barely notice that they have long haul syndrome, and some people don't notice that they have long haul syndrome. And that subset of people, if you run the tests on them, you'll see that there's inflammation in the background. And so, in that group of people, I would still be a little bit concerned if somebody had, a viral infection that triggers long haul syndrome, or an injection that may cause, similar syndrome. They might want to be tested even if they have no symptoms at all, because just like if you have high blood pressure and you have it for 20 years and you don't know it, you don't feel it unless you go to a doctor and get your blood pressure checked, you could end up, developing, dementia, heart disease, a stroke, 20 years from now, because you've had untreated high blood pressure from the time that you were 20 until you were 40, and then suddenly you have a heart attack or a stroke, or start developing, early onset dementia, right? So that happens, um, and it's in the background. You're not aware of what's going on until a disease actually develops, and it could be years later when that happens. So the underlying cause of all human diseases is inflammation. All right. And so that's what's happening with long haul syndrome. You have inflammation in your body, and it might be this moldering, like low level inflammation that you are unable to even appreciate. It's not causing any symptoms, but it could be setting you up for chronic disease in the future, in the next few years, or in the next decades. Sooner or later, that inflammation will catch up with you. As your body gets older, eventually you'll be less able to put up with the inflammation, or it'll just kind of wear down your organ reserve. So everyone is born with a certain kind of like capacity and like a health span that's kind of coded into their bodies. And um, and so in healthy normal people, that health span will basically coincide with your lifespan, so you'll stay healthy for 75, 85 years, and then in the last few days to weeks to months of your life, you'll start to things will start to break down and you'll get sick, and then you'll pass away. But you'll spend 99.99% of your life being able to take care of yourself, and feeling good, and being healthy, being able to think, being able to feed yourself, go to the bathroom, get out of bed without help. Um, but in some people, with chronic inflammation and chronic disease, that health span gets shorter, even though the lifespan may not get a whole lot shorter. But it's pretty miserable to spend the last, 5 to 10 years of your life, or 15 years of your life bedbound, or requiring help from other people. Um, and so it's important, even if you don't have symptoms, to maybe put this on the table and consider that there could be this chronic inflammation, because we know that S1 subunit is a toxic thing. It's kind of like the bullet in the gun. And you can get it from an infection, you can get it from an injection. Either way, that bullet, you know can do some damage. Um, so um, so getting back to, so how do we kind of approach this? So people will come to me, and if they tell me that they have these typical symptoms and it happened in the last couple of years, I'll oftentimes be able to make that diagnosis just based on the typical symptoms of the illness, whether it's and sometimes people come with the typical kind of constellation of symptoms, that pattern of symptoms, and they don't have any history of an infection or an injection that may have triggered it. They may have had an infection or an exposure that they weren't aware of, right? And a lot of people, a lot of healthy people in this country, got infected, developed natural immunity, and they weren't even aware of it. It was such a mild thing, but it can still cause long haul syndrome. And so if you come with those typical symptoms, there's two things that we can do. Either we can try treating it, empirically, as we say in medicine. You try the medications that work for that illness. You just make a diagnosis based on the presentation. Try those medications and see how the person does. If they get better, great. Maybe they did have the illness. Maybe those medicines did make them better. Maybe it's just a coincidence. Either way, the patient's happy, I'm happy, they feel better. The other possibility is that we go ahead and go straight to the testing, right? We want to confirm it. So maybe you didn't have a diagnosis at any point. Maybe you didn't fall ill in the last 2 years. You weren't injected, and you're like, I have these symptoms. What could it be? Maybe it's long haul. Maybe it's something else. And certainly, if the symptoms are kind of like, if we're unsure of the kind of presentation, we could go straight to covidlonghaulers.com, give them my name, register with them. Request a lab test. They'll give you a local lab that you can go to. They'll draw your blood. That lab ships the test. I think that the kit to California, where they run the blood, and within a few weeks you get the results. You can come back, talk to me about it at mygotodoc.com, or you can um, schedule a consult with one of their doctors also to talk about it. They don't prescribe medications, so they do want you to have another doctor like myself, or anyone else who's willing to prescribe, your PCP, if they're willing to prescribe. In my experience, it's extremely rare to find a PCP who's willing to prescribe the medications that they recommend. Regardless, you can get the test done and you can see, and they'll let you know, like, hey, it looks like maybe this is long haul syndrome based on the report. Based on, they look at interleukins, they look at cytokines, they look at CCR5, they look at all these things that are basically inflammatory markers. And there's no other place where you can't order all these tests yourself and kind of like cobble it together yourself. And thank God they don't really charge too much for it. I think it's, last I checked, it was like $300 for the test. I mean, that's a pretty normal price, and they could have charged anything. I mean, it's not available anywhere else that I know of, and it's cutting edge. It's cutting edge science. It's based on machine learning and their own research. So Dr. Bruce Patterson's research. So really, it's a tremendous test, and it's really helpful. And it can be helpful in a number of ways. Even if we diagnose, if I diagnose a patient with long haul syndrome, they come to me and I start treating them, and we want to kind of track our progress. Maybe the symptoms aren't getting better right away. So that test can help us. If we take the test before and then we repeat it after a month, or every month, or every 6 weeks or so, we can see, are we headed in the right direction or are we not? Because there's different subsets of patients that I treat for long haul syndrome. Some of them will start to get better right away, within days of starting treatment with the drug that we call IV, um, or maybe a steroid, maybe something else. Codename Ivy, basically. So some people get better right away. Some people won't get better. But if that test shows that they're headed in the right direction, the inflammatory markers are coming down, it kind of gives us some confidence that we're doing the right thing, and we should continue doing what we're doing. And eventually, those symptoms will catch up, and the symptoms will also go away. Um, the other possibility is that patients do get better, but it's really gradual and really slow, and you just want some confirmation from the test that you're headed in the right direction. And the other possibility is they don't get better, and we do it. We do different treatments. Kind of like follow the protocol from the FLCCC and certain changes that I've made to the protocol, and we follow it for a couple of months, and we don't seem to be getting anywhere. And then we're just like, we throw up our hands and we're like, let's do the test just to be sure, that this is long haul syndrome. Where are we at with the inflammation? And the other nice thing about the test is that it helps you, in some ways, identify which drugs would be most likely to help, right? So should we upgrade from aspirin to Plavix, which is a stronger blood thinner? Should we try Maraviroc, which has a list of some, serious side effects? Um, uh, and so it's kind of the last thing I would try, but it's a possibility, and it does help a lot of long haulers. We've seen hundreds, if not thousands, at this point, of long haulers get better within 2 to 3 months using Maraviroc. So that's how the testing works. So what do I do? Like, how do I treat most patients who come to me? So most patients, we're going to use IV, which is code name for a drug that's really hard to get in America nowadays, and it. There was an earlier Trump drug that was really hard to get before. Now that drug is kind of easy to get, HCQ, and now IV is the one that's hard to get. So that my approach is to start with the safest medication that's most likely to work. So that for most people is IV, the horse paste, and we'll try that. We'll try it. Basically, the FLCCC protocol is what I'll try. I kind of extend it a little bit and do it a little bit longer for most people, just to be sure, because a lot of people get better, but some people you need to take it for a couple of weeks, and sometimes we'll escalate the dose from zero point 0.2 milligrams per kilogram up to zero point 0.4 milligrams per kilogram, just to see. And then after that, if that's not working, we can add prednisone. Dr. Mubin Syed's protocol, which he kind of developed with the FLCCC, or for them. So he started off, his initial protocol was just like 6 days of a low dose steroid, and then he kind of like extended it to 2 weeks. And I think 2 weeks works better for most people. So 15 milligrams a day for 5 days, 10 milligrams a day for 5 days, and then 5 milligrams a day for 5 days. See if that works. Oftentimes that works, with or without ivermectin. So sometimes you have to add an extra medication to ivermectin. Maybe ivermectin helps, reduce your symptoms by 50%, and then it doesn't seem to get much better from there. Then I would say, okay, continue the ivermectin, add the prednisone. You know, Maybe that helps another 25%. Now you're down like 75% improvement. Then I would say, okay, if you have neurological symptoms, maybe add fluvoxamine. If you have other symptoms, we can add an omega-3 fatty acid as suggested by the FLCCC protocol, or you can get the prescription strength one called Vascepa, which is quite expensive. So you want to just double check if it's covered by insurance. Otherwise, 2 grams twice a day of just an over-the-counter omega-3 fatty acids is a good replacement for Vascepa. Other things, I kind of got ahead of myself with the prescriptions. The first thing that a lot of people will want to try is just diet, and supplements. So again, the FLCCC protocol is a great place to start. And in terms of diet, some things that I see help would be a low histamine diet. Again, we're getting back to the idea that this is kind of an allergic kind of disorder, right? Like mast cell activation syndrome. The underlying issue might be an allergic issue. Your body is more prone to this allergic kind of state. And so you know at the lowest level, I mean, what's causing allergies? It's histamine. So you have antihistamines like Benadryl. But that's it makes you drowsy, so it might be good at night. But during the day, you can try an H1 and an H2 antihistamine. So Claritin or Zyrtec plus Pepcid, which is famotidine. So you're going to be blocking the H1 and H2 histamine receptors. A lot of people find that helps. Some people it doesn't, but it's worth trying. It's over the counter. It's easily available, and you can actually do a little higher doses than they recommend over the counter. So instead of once a day, you could do twice a day, sometimes even 3 times a day, depending. You kind of have to titrate things and see how they work for you. Um, and The other important things, I think aspirin is a big one that helps some people because some people may have microscopic clotting, and aspirin helps to clear that up. They may have intravascular inflammation, which aspirin helps to clear up. Um, Another other important things are turmeric or curcumin, and black seed oil. So these things also work for the acute, syndromes, the acute infectious syndromes, and they also work for long haul syndrome. And then just the standard vitamins that everyone's using for the acute and for prevention, they also work really well for long haul. So vitamin D, vitamin C, zinc, quercetin, and then NAC. That's another good one for long haul. Some people have told me that olive leaf extract helped them with long haul syndrome. And there's some other things, other supplements that people have recommended. Life Extension has a couple of supplements that have been recommended, and that I've included for some people in the protocol. In terms of diet, along with the low histamine diet, which you can try, would be fasting. Intermittent fasting has helped a lot of people. There's a protocol out there floating around that I can send people who request it, which basically that's the basis of the protocol is this intermittent fasting, and even longer fasting, like 24, 36-hour fasting once or twice a week. Some people found that by itself helped. And why would that help? A lot like ivermectin, it actually helps your body get rid of junk proteins, right? So it helps to get rid of things that you don't really need anymore, like the S1 subunit of the spike protein. So fasting, some supplements. I would recommend avoiding, aggressive exercise. So if you're going to exercise, look up what zone 2 heart rate exercise is. So it's like a low intensity exercise. And the problem here is that long haul syndrome has a lot of overlap with chronic fatigue syndrome or myalgic encephalitis, and a lot of people with chronic fatigue, myalgic encephalitis, find that they actually get worse with exercise. And I find that that's very common with long haul syndrome, worsening with exercise. Sometimes it even triggers the syndrome itself. So normally exercise does cause inflammation, but your body kind of rebuilds stronger. With people who have long haul syndrome or chronic fatigue syndrome, from other things, a certain subset, they'll find that the inflammation just kind of gets out of hand. It never goes away. The exercise will cause inflammation, and then it'll just continue, and you're not going to rebuild stronger. You just continue to feel worse. And so some people will come to me and they'll say, "Doc, I feel better like right after exercising or even that day, but then I feel terrible. I'm wiped out for like a week or 2 weeks after that." So a lot of people do see that. So you can try weight bearing exercises that don't get the heart rate super high. Maybe doing something with kettlebells, maybe a farmer's carry. You're holding two kettlebells. Or maybe just walking, and you might try swinging some dumbbells while you walk, some light dumbbells to make it a little bit harder, a little bit more of an exercise than just walking would be. But you want to really take it slow and just kind of like really really slowly, you know get into exercise and see how you feel. It should be leaving you feeling better, or if anything, not feeling worse. So the main goal of treatment is to diminish your symptoms. And that it sounds kind of like you're not really addressing the root cause, but in this case, it often does address the root cause. So it's not just like like a band-aid that you're putting on top of the symptoms, but when your symptoms get reduced with a medication or an intervention like lifestyle diet that is actually addressing the root cause, that's great. And that's what we're aiming for. We're trying to address the root cause, but in when the root cause is addressed, you'll actually see the symptoms diminish. And so the symptoms are caused by inflammation. So anything that helps reduce that specific inflammation causing your symptoms will help reduce your symptoms. And at the same time, the inflammation is kind of setting up this vicious kind of cycle. So the inflammation is triggered to begin with by the spike protein, or the S1 subunit specifically of the spike protein in those atypical monocytes. And then the inflammation causes the symptoms, and the inflammation itself gets in the way of your body clearing out the S1 subunit of the spike protein. So it's this vicious cycle, right? It just feeds on itself. And so if you can interrupt that vicious cycle by stopping the inflammation, suddenly your immune system kind of resets, and it kind of goes back to normal, and then it's better able to get rid of that spike protein. So you want to hold down the inflammation, kind of like suppress it, so that those atypical monocytes can be, destroyed. Um, you can get rid of them, and you can get rid of the spike protein, and then new monocytes take their place, and then the job is done, right? We've gotten rid of the spike protein. And then we can remove those things, the medications, the supplements, the dietary interventions, the different things that we added on to deal with all of this. We can remove them, and this vicious cycle won't start up again because the initiating factor, the spike protein, is no longer there. So that's the main approach to long COVID. And again, we start with diet, exercise, or like minimal exercise, maybe no exercise actually, or trying just weight bearing and level 2 exercise gradually, plus some supplements, plus prescription drugs if you need them. And then there's other things, like when I was dealing with it myself, I I was just, it was uncomfortable, right? It made you uncomfortable. You didn't feel good. You had anxiety. You had you couldn't sleep. I couldn't sleep. All these things, right? So I was like looking for things like, how can I feel better until this is over, right? So for me, what I did I learned some. I had learned some qigong, which is kind of like a tai chi type of thing. It's kind of like tai chi movements plus breathing, and so it's an ancient Chinese art. Basically an energy art, or similar to like yoga and tai chi. It's a movement modality, and it the basic thing is it helps you to relax, learn to relax, right? So learn to relax and breathe. Um, and and a lot of things, you'll feel better from a lot of things just by learning to relax your body and to breathe deeply and from your belly. So it really helps people who have the kind of like the heart rate shooting up and the blood pressure pounding and the anxiety and the trouble sleeping. There are exercises that you can learn to help you kind of wind down at night. And then obviously like sleep hygiene. If you're having trouble sleeping, you need to clean up your sleep hygiene to kind of maximize your ability to sleep until we get rid of the spike protein for you. Um, and you can look up sleep hygiene as a number of things, but you want to set a bedtime at night. You want to avoid like screens for a couple of hours before that. You don't want to eat for like 3 hours before bed. You want to sleep and wake up at the same time, get most of your sleep before midnight, and then maybe have a short afternoon in the a short nap in the afternoon. So those are the best times to sleep. If you're trying to sleep outside of those times, they're not going to be really restorative sleep. um, but you still may be waking up in the middle of the night. So you may have to kind of like take a little extra long nap in the afternoon for a while, until we get over it. And then other supplements that I found beneficial for the anxiety kind of symptoms were things like, what is it? Some essential oils. So you can get online a lavender essential oil capsule. And so it's like a drop or two of lavender essential oil in a little gel cap. You can swallow it. That helps a lot of people with anxiety. I mean, some people report that you can look up the Google reviews, or the Amazon reviews. Some people say it's as good as like prescription strength anxiety medications. Um, and then there's a lot of other, symptoms that people want to kind of like, address. And so, for example, depression, right? So you want to make sure with depression that you try to smile every day. So this was part of my qigong exercise. Like one of the exercises was just like smile from your heart, right? Like you really mean it, and just pretend if you don't really mean it. But just moving those facial muscles every day will brighten your mood and help with depression. Another thing that's really great for depression, so I have functional medicine training and lifestyle medicine training, and the number one thing I found that works best for depression is going and making somebody else happy every day. Okay, so that could be, one thing that works like amazingly well, which unfortunately was hard to do during the pandemic, is go to a nursing home and just like sit and visit with somebody you don't even know. Okay, and especially somebody who doesn't have visitors. You will brighten their day and their life. So I've done this myself. Somebody told me, and I was like, my God, that is a fantastic idea. There's so many people depressed in nursing homes. No one visits them. They have no family. You go there and just sit with them for a few minutes, once a week, and it can change their life and it'll change your life, I guarantee you. So doing something to bring a smile to somebody else's face every day, smiling yourself, brings a smile to other people's faces. That's another reason it's really helpful. Smile and the whole world smiles with you, right? So there's so many different things. I actually have a couple of blog articles up about different things that you can do to diminish symptoms of like anxiety, depression. That's on my website, under the blog at mygotodoc.com. So, a number of different things from the functional medicine sphere can be tried, to help with the symptoms until we get rid of the root cause. And so again, once we get down to medications, the initial one is IV, the one that starts with IV, and and then the prednisone is often very helpful. Pravastatin sometimes helps. Aspirin, sometimes Plavix. Pravastatin, I don't really like statin drugs, but they do help with the intravascular inflammation for some people, and I would highly recommend taking coenzyme Q10 with them to limit the risk of side effects. And if it was me, I probably would hold off on the statin and try the other things first, right? So, there's other things that you can try. Some people have told me that HCQ works really great. I mean, I've heard, I myself haven't had a lot of experience using it for long haul. And when I did try it, it didn't seem to help. But some people have reported it helps. Some people reported colchicine helps, especially if you have like really bad body aches. Some of my patients have really bad muscle pain, sometimes joint pain. And so colchicine is a gout drug, also a specific kind of anti-inflammatory that helps in the acute, syndromes. And for some people, it helps a lot actually for long haul. And, I've spoken to Dr. Daryl DeMello in India. He's used it for like tens of thousands of patients. And his experience in that, population in the subcontinent in India works fantastic for every, part of the disease, even long haul. He uses it for like 30 to 90 days in patients. In the US, I've tried that, and a lot of people just can't put up with the side effects. So around 10% of people will have really nasty, abdominal issues, diarrhea, nausea, stomach pain with colchicine, but other people don't. 9 out of 10 people are fine with it. And so that's, another thing that kind of keep in the back of my mind. If other things aren't working, that's something worth trying. Fluvoxamine or Prozac, they both work the same way. So fluvoxamine is Luvox, Prozac is fluoxetine. So these are two separate, SSRIs that are usually used for anxiety, depression, OCDs, kind of things, and they work like a charm for, especially for neurological symptoms of COVID. So IV doesn't pass through the blood-brain barrier. You don't always need to go into the brain directly to treat long haul syndrome, because a lot of the inflammation is actually in the body, and the inflammatory markers are passing through the blood-brain barrier, causing problems and symptoms. So you don't necessarily have to start with something that goes into the brain, but sometimes you want to use it, and especially if you have neurological symptoms, so things like loss of taste, smell, ringing in the ears, brain fog, things like that. And sometimes, actually, the shortness of breath, I think, is primarily a neurological symptom, and it's not really in the chest, because we'll get patients who come to us with perfectly normal oxygen, perfectly normal CT scans, and they still have horrible shortness of breath. They feel like they cannot breathe. So that is up here. So neurological symptoms, SSRIs may be helpful. I mean, again, I don't like SSRIs, just like I don't really like statins. I don't never use them really before in any of my patients. Um, but it's one of the things in the toolkit. If you need it, you can use it, and use it for the shortest period of time possible. Maybe 2 weeks up to 3-4 months, and then wean off of it and try to get off of it. I really do believe that SSRIs can have some serious issues and serious changes to your brain if you use them over the long run. So I wouldn't recommend being on them forever. You know, but some patients find that that's the only thing that works, and if they try to wean off them, they get worse again. And so in those patients, I just tell them, hey, keep trying to wean off, like every few weeks or every month or every 6 weeks. Try to like gradually withdraw the drug, and eventually you should be able to withdraw it and not have the symptoms anymore. Eventually your body should clear out the spike protein. you know Human beings are so different. There's such a range, right? So some people get better in days, some people get better in years. All right. So these are both like, very rare, both ends of the curve. But the majority of people are in the center of the curve, and they'll, most people get better within a few weeks or months. But a rare patient might take a really long time, and you might have to taper, or like, wean them really, really slowly. So you've got the fluvoxamine, the pravastatin, aspirin, IV, HCQ, colchicine, and then Maraviroc is kind of like the last thing that I would usually recommend trying, just because if you look up the side effects of Maraviroc, you're going to find things like heart attacks, cancers. So Maraviroc is an HIV drug. It's used in AIDS patients, and they use it for years. So one, you're looking at a population of AIDS patients, and two, they've been using it for years. And so all the side effects that are listed, scary sounding side effects in the medication insert, are specific to that population, specific to the duration, right, for years. But You never know, right? So we haven't followed up with COVID patients for years. Even the patients who used it just for 3 months and they did fine, they had no problems, their labs all looked good, they felt better, they came off the Mravrock. We don't know what if we follow up with them for 5 years? What if we run a huge study of 10,000 patients and we follow up with all the COVID patients after a 3-month course of Mravrock? We check them after 1 year, 2 years, 5 years, 10 years. Maybe we'll find that there's problems. I don't expect it. No one who's using it expects it. But that's the reason that I kind of like set it aside, and a lot of patients kind of hesitate to take it because it is an HIV drug and it does have those side effects listed. But it works like a charm to help your immune system kind of get rid of those specific monocytes that are holding on to the S1 subunit of the spike protein. So it's kind of kills two birds with one stone. It gets rid of the inflammation that they're triggering first of all, so your symptoms get better, and then it helps you kind of like your body to kill them off and get rid of the spike protein at the same time. So 1-2 punch, and it's hard to really overemphasize how effective it is for it's probably it may be the most effective single agent for long haul syndrome if you need it. So Bruce Patterson's experience, I think, at this point is something like 80% of people get better if they take Mravrock or follow their protocol, which is almost always includes Mravrock, and follow it for a few months. So let me see if there are any questions here from any. Yep, we'll see. Let me just scroll up and. Is the presence so Josh Lehman, hello. Is the presence of the spike protein always correlated with long haul symptoms, or can you have the protein present and have no symptoms? Yeah, you can have the protein present without symptoms. So, like I was saying, earlier, some people will just have inflammation from that protein. But I'm worried about those people too, because the inflammation may be causing disease over the long run, just like people who have high blood pressure or elevated blood sugar. These aren't things that you feel, right? So yeah, you can have no symptoms and still have something abnormal going on in your body. And if you have the spike protein present, I would check to see the in-cell-kind panel to see if you find those inflammatory markers out of whack, and in which case I would treat it even though you don't have symptoms. Dan Starr, hello. Can vaccine injuries snowball over months until severe lung damage and sepsis occurs? Um, So vaccine injury, I don't usually see it getting worse over time. Sepsis specifically refers to like typically to an infectious kind of syndrome, or a syndrome that follows along with infections. Um, so severe lung damage does occur. Typically it happens in the beginning, and it's kind of something that you're dealing with, and then it doesn't continue to get worse. So it's possible that that could happen. I have not seen that happen yet. So I haven't seen like a snowball effect of worsening lung damage. Although theoretically it is possible, right? Because if you have persistent inflammation in your lungs from the spike protein, theoretically that could cause continuing damage to your lungs and eventually interstitial lung disease, fibrosis, and those patients are really really hard to treat. But typically, what I've seen is patients who had the disease up front in the ICU. They got a really bad COVID or maybe a bad vaccine injury, and all that damage happened right up front in the beginning, and then it just becomes chronic, and it's not actually getting worse over time, as far as I've seen. But it's possible, and there's not enough research on this, so it's kind of an open question. Um, 5 different doctors have no idea what caused the pneumonia. Yeah, so when people talk about pneumonia with in the setting of COVID or a vaccine or whatever, um, it may not be literally pneumonia. So pneumonia is typically an infectious disorder, and with COVID, oftentimes it's pneumonitis, which is an inflammation of the lungs. Um, and so the COVID pneumonitis, the pneumonitis or the inflammation that you see from the spike protein has a typical appearance, but not always. So if you see the typical appearance, then you can the you know the person who's reading the CT scan can be like, hey, this looks kind of like COVID. But tests and scans, that they don't always have the typical appearance, and they can still be caused by that. So in a patient like this, where like a bunch of people have no idea what's going on in these times, I would say, hey, just run that incell dx incell kind panel and see if that's what's going on. You mad bro or not? Says I had COVID two times in March 2020 and again in September 2020, and have been vaccinated. I'm suffering from long haulers and I've tried the FLCC long haulers protocol and it didn't help. Yeah, so if you've tried everything, then the next step would be, I don't know if you tried Mravrock. They do mention Mravrock as like a last ditch kind of effort on the FLCCC protocol. Um, but another thing that I did honestly was that, this was back when I didn't know anything about long COVID. There, I don't think the FLCCC existed in like February, March, April of 2020, and so I went to an herbalist, I went to an acupuncturist, and I found that the herbal protocols they gave me actually helped a lot with the symptoms. So that's another, you got to just cast around until you find something that works. Try different things until you find something that works. And if you haven't tried the fasting protocols, those might be helpful. But cast a wider net. Try alternative medicine, try Chinese medicine, try herbal medicine, and those kind of every modality. It really depends on the practitioner. Don't just write it off because you go to somebody and they don't do anything. Chinese medicine, it's really hard to find a really good Chinese medicine practitioner. I can tell you from experience. If anyone's in North Carolina near Asheville, there's two clinics, Sissy Majibi's clinic and the alternative clinic in Asheville. They both have really high level practitioners. And if you're not there, then you can call them up and ask them, do they know anyone in your area that does herbal medicine? Um, TC, I'm glad you felt better. Thanks, Thomas. Let's see. Again, I'm dealing with a lot of brain fog, extreme anxiety, and other symptoms that are always continuous. Yeah, I had pretty bad anxiety too, for hours. Yeah. Let's see. Yeah, sometimes like you said, it didn't help. Maybe you didn't try it long enough. Some people, again, will have to use it for months and maybe even years, unfortunately. But you should be seeing some benefit after a month or two with whatever you're doing. There should be some indication that you're headed in the right direction. So Rob Massa says I had a variety of long COVID symptoms, including inflammation, lymph node issues, which were treated. Great. And then contracted COVID again in January. Unfortunately, yeah, I got it again. I got Omicron. I thought we were all safe, with natural immunity. It didn't turn out to be that way. Um, you're welcome, Cedric. Rob Massa, very mild, but now have diagnosed with AFib. Yeah. Um, Yeah, so people haven't come and told me that they got AFib, but I would expect it to be quite common, actually. So AFib, I think, can be triggered because long COVID can trigger tachycardia or higher heart rates, and higher heart rates make you more prone to AFib. So I would not be surprised, although I have not seen a lot of AFib, and which actually has surprised me. So you're actually one of the first people who's told me that you got diagnosed with AFib. But again, AFib is a really common issue, and I would totally expect it to be quite common amongst long haulers too, even though I haven't seen a lot of it. Um, yeah, the aspirin for 6 months post COVID. I don't think it probably won't hurt. I mean, aspirin, it can cause some issues with the stomach. It can cause stomach bleeding, ulcers. So you just want to be careful about that, especially if you're prone to it. I generally typically recommend aspirin for at least 30 days with a COVID infection. And, but if you don't really know, if you don't know if you have the spike protein, you don't know if you have the chronic inflammation from long COVID, it might be safer to stay on it for 3 months or even longer. So if your cardiologist said 6 months, definitely listen to your cardiologist. I mean, they know you better than I do. Um, Yeah, you're welcome, Matt Spano. Multi-drug approach, I agree, works. Pleurisy in the left chest since COVID. Hey, Matt Roberts. Yeah, that's another common symptom. Pepsid and Claritin are great. Yep. Matt Spano says he's had insomnia since mild case in January. Yeah, I had that for months, but not every night. Yeah. I found some nights were better, which kind of points to the fact that there is something in your lifestyle that's contributing, right? So some days or some weeks, maybe you're doing something that is helping you sleep better, right? Maybe it's something that you ate different, and it might be related to histamine in your food. It might be related to just the stress in your life. It might be related to blue light after dark, there are all kinds of things, or it might be like 15 different things all added together. And, you know, the relative number of those things that you have on certain days may be less, and other days it may be more. But those kind of things that people notice that, like, sometimes it's good, sometimes it's bad, kind of point to the fact, how powerful lifestyle is. And if you can just figure out what it is in your lifestyle that makes you better, people have to become like, experimenters. You got to experiment on yourself. That's the only way that you can oftentimes get to the bottom of really serious chronic problems, is to learn how to experiment on yourself. And the way to experiment on yourself, how do you do that, is to change one variable at a time, right? So you got to think like a scientist and be like, okay, we're going to run an experiment. I'm going to do everything the same, except I'm going to add turmeric, right? And it takes a long time, and people don't have the patience to do it, but that's really the only way to be certain that, okay, this is what made me feel better, or this made me feel worse. And that's another reason that I tell people it's best to do one medicine at a time. You use it for at least a week or two before adding another one, and then you can drop the ones that make you feel worse, keep the ones that make you feel better. And it's a little bit more scientific. Some people don't have the patience, and they'll just be like, I'm gonna just take all 5, 6 medications you prescribed all at once. So to each their own. um, let's see. uh, Seen any weird joint inflammation post-infection in people? Yes, I have seen joint inflammation, people with arthritic kind of symptoms. So David says he got bursitis in one elbow a few weeks post-infection, went away and then appeared in the other. Yeah, that's not unusual, actually. Um, let's see. Matt Roberts is asking, I think, about the pleurisy, right? I have seen pleurisy. Yeah, yeah, I have seen that. Let me see. So David says that you were tested for autoimmune conditions, gout, etc. All of that's negative, just general markers of inflammation in the blood work. Yeah. So that's when I start saying, that, hey, it might be the spike protein, might be long haul syndrome, and the incell-kind panel will probably confirm that. And you may even, if as far as I know, they're running the S1 subunit test, so that would also be confirmatory if you found that in the monocytes. Um, Yeah, not vaccinated Matt Roberts did get monoclonals 24 hours after testing positive, which is great. Uh, so if you took ivermectin immediately after the positive test, did another round for about 10 days a few weeks ago. Um, I don't know how to say your name, Zuoko, but you're welcome. Um, Paxlovid, Splat Hub says, heard that Paxlovid could potentially help with long COVID as an antiviral. Yeah, I don't think so, honestly. I would be interested in hearing if anyone's tried it, but so Paxlovid has, like, you can see why it would help in the acute infection, because there's a virus that's multiplying, and if you start it really early, it would inhibit the protease. It's a protease inhibitor, and it would inhibit the virus's ability to replicate. But long COVID is not. It's not like AIDS or HIV. It's not a chronic infection. So we have yet to prove anyone, very very few people, like you're talking about, like 1 in a million might have like a chronic actual infection. It's possible, but you know 99.99999% of people who have long haul syndrome, all we've been able to find is the S1 subunit of the spike protein. So there's no active virus. It's just like this little piece of the virus that's causing the infection. So I wouldn't see how a antiviral would help. Anika, you're welcome. But major ME, myalgic encephalitis, I suppose, arthritis. Now, yeah, that sounds like long haul. And I hope you feel better soon. Brian Gresh, 90% better since treatment. Ear ringing, mild symptoms have returned. I've been putting off retesting because I felt generally pretty good. And honestly, Brian, I think a lot of people are in your boat. Like you get kind of like 80, 90% better, and then you're like, that's good enough. And I'm just not going to bother with it anymore. I mean, who has time to go down the rabbit hole for this thing? And but I would recommend, you know trying to get rid of it, because like I said, you have the symptoms, the inflammation's still there. Maybe it's taxing your liver or your heart or your brain or your pancreas, and maybe that will, kind of push you over the edge into some kind of chronic disease later on that you don't want, right? So I think it's important to try to treat it down to zero symptoms and zero spike protein left, and zero inflammatory markers left also. So ideally, ideally I think everyone would check the incel kind panel and make sure that they get to normal and make sure they don't have the S1 subunit and the spike protein in their body, and just confirm all of that. It's not too expensive, honestly. $300 plus I don't know how much the S1 subunit test costs. Um, Anika says cancer, metastatic ductile cancer is their relationship to long haul. Yeah, so cancers are being reported with the injections, right? And um, so I would expect them with long haul too. So the injections, personally speaking, I think they're far worse because the lipid nanoparticles take the mRNA everywhere in your body to places the virus would never get to. It gets really deeply into you, so like the virus doesn't like typically stays at a very surface level, and the injections go very deep, right? They go into your ovaries, they go into your bone marrow, they go all over the place, right? They go through the placenta into the baby's ovaries, they go into your brain. So blood vessels and other cells all over your body, deep inside your organs, are creating spike protein, causing inflammation. So for this reason, I think you're probably going to see cancers sooner with the injections, but maybe later on with long haul syndrome. We haven't heard a lot about cancers with long haul syndrome yet, but I think they're coming, and they're probably going to get worse with the injections too. Um, Zioko said he had similar symptoms from Matt Roberts and got better with low histamine diet supplements, prescriptions, and taking it easy. Yeah, taking it easy sometimes is important. Rick Kruer says any changes with Omicron with preventive ivermectin, still recommended twice weekly. It is being recommended twice weekly if there's enough, if there's a significant kind of load of cases in your area, or if you feel that you're at risk. So should we stop since Omicron is milder and then take ivermectin yeah. So kind of trying to decide whether you should stop taking it twice a week. I think most people in the US at least probably twice a week is like, you may not need to do that because there's just not a whole lot going around anymore. But I would take Omicron seriously and treat it on day one. And the only way to do that is to just assume you have COVID and start treating it, because that's safer than not treating it. The meds are safe, and so the goal is to prevent long haul syndrome, and I think that should be the goal for most people. But yeah, for most people, probably just keep it on hand to treat right away. Yeah, this is a real background, Dale. Um, yeah, if you see some of the books that I put up there, then it's kind of like, I didn't write them, but people should read them. um, so Jen Kranja, I hope you're saying, I hope I'm saying your name right, maybe Kranya. You treated me twice for COVID, Delta and Omicron, and both times I recovered 100%. God bless. God bless you too. Yeah, that's great to hear. Um, for past 2 years, so existence.com says for the past 2 years, yeah, that was a great website back in the day. It probably still is. That was one of the first websites actually that I posted my name up there, online for as a doctor who treated off-label for COVID. So exstnc.com. For the past 2 years, none of my family, friends, or who I use antiviral nasal spray gargle each day when I have contact with others have had COVID. Yeah, this is actually one of the most important things, right? The nose spray, mouthwash, gargling with diluted iodine or diluted hydrogen peroxide. That one thing could have ended the pandemic. You know, that one thing. If everyone was just told to do that at the first exposure, or in a situation where you're at high risk, or at the first sign of symptoms. I myself have seen that. Like, I was, a couple of times actually. Now I've felt like that tickle in the throat. You're coming down with something, and in a day or two, you're going to have a sore throat and maybe a runny nose. I did it. Next day, totally fine. No symptoms. Sometimes even after a few hours, you feel better and you don't get worse. So that's happened enough times now that I'm like, this stuff really works. And why wouldn't it? I mean, it kills on contact, right? And if you don't get enough viral particles into your body, you're not going to get sick. So one viral particle or two or 100 aren't going to make you sick. So if you can wipe them out, kill them, on contact, 100% death rate in your nose and mouth where they're entering, you can end that thing in the beginning. So yeah, that's the number one intervention, I think. Better than vitamin C, D, zinc, quercetin, ivermectin, everything, right? It's the number one in my book right now for prevention. Doing that regularly, maybe 4 or 5 times a day, if you start to feel you're coming down with something, or if you went to a conference or something, you think you're high risk. Yeah, can't recommend that highly enough. And you can I have the free ebook on my website, mygotodoc.com. I'm pretty sure that the directions for creating that are in the ebook. And if not, you can just ask someone on my staff will give it to you. Dale Heim, can you do natural health assessment and telehealth appointment? Yeah. I just don't have time nowadays because we're so overwhelmed with long haul and COVID, right? Like there's not enough people treating long haul. So we're just spending all our time trying to focus on that. And now we're doing these like antibiotic prescriptions for like preppers in case of emergency. But the primary thing that I focus on is long haul. And I will be going live with 50-minute consults with me in the next few days, probably maybe next week, early next week. And I guess I could talk about whatever somebody wanted to talk about, but like if somebody's looking for like soup to nuts, like functional medicine deep dive, I'm not the best person because I don't have like the relationships with all the different advanced testing labs set up. But I could talk about and give people advice and review their labs if they have them and help them out with that. Um, Brown Bomber, thanks for the scripts. Yeah, the hospital protocol. Yeah, it's enough to make you angry and worse. Yeah. Yeah, I'm extremely disappointed and angry with big medicine, big pharma, and hospitals. Yeah, with big everything. Yeah, it's a big problem for our country. Do you have a Substack? Yes, I do. Maybe I'll post it in the links at the bottom after this is over. Generally speaking, I mean, so far it's just the stuff that's on my blog. I think I cross post it to Substack usually. So you can find most things at drsyedhaider.com, which is drsyedhaider.com. The blog over there has pretty much everything I've written. All right, I'm going to try to get through the rest of these comments and stuff real quick, and then come to an end here. So, but thanks so much everyone for showing up. This was really fun. I mean, this is the first time for me doing this. I think I'll start doing it more often if I can think of something to talk about. Give me some ideas if there's some other stuff you want to hear. But Bud and Bloom says kindness is medicine. Absolutely. Vianney Rizzo says, do you have any recommendations post-COVID? I smell fish frequently throughout the day. This is a long COVID symptom. Yes, this is a long COVID symptom. Altered altered smell is another big thing, which can be really really annoying. And everything that I talked about, may help you, right? Maybe just an antihistamine helps you. It's hard to predict what's going to help one person, but the kind of go-to thing that we often think of with neurological symptoms like the smell is fluvoxamine or fluoxetine. Again, if it was personally me, I don't like those drugs that much, so I would try everything short of using those you know, before I tried those. But I will tell you that oftentimes that is the thing that helps. But sometimes ivermectin helps, so why not try that first? Alan Green, thank you for the prescription, September 21. I'm glad to hear you're recovered. Andrea Onguro-san, hope I said your name right. Hi, Dr. Hyder. Any suggestions to treat chronic fatigue syndrome due to COVID? I'm a nurse and a long hauler for 1 year and still can't exercise and get fatigue easily. Basically everything I said. Yeah, the FLCCC protocol is a great place to start. And some people unfortunately need to take a break and take it a little bit easier for a while to recover. And I know nurses work like 12-hour shifts or longer, sometimes 3 or 4 times a week. So I mean that the lifestyle, you may need to cut back, take a break if you're actually doing that right now, for maybe until you feel better. So unfortunately sometimes you do have to kind of like change the lifestyle for a period of time to give yourself a chance to recover fully. um, John Dysentery. What is the actual name of the test to assess free circulating spike protein? Yeah, so it is, as far as I know, S1 subunit test from IncelDX or covidlonghaulers.com. You can ask them for that test. Jennifer Hopkins, what about quercetin? Yeah, definitely quercetin helps. Quercetin, addition to helping zinc enter the cell, also has antihistamine effects. So it's a kind of like a mast cell stabilizer. So mast cells are what release histamine in your body. So that's one reason quercetin actually helps with long haul and the acute illness also, because a lot of it's related to histamine and allergies. Judd Miller, good to see you making more of a public presence. Yep. You're welcome. Brown Bomber, what are your thoughts on the snake venom news this week? Yeah, so this is an interesting thing. And so the presentation was a little bit confusing. I listened to some of it and then I looked up, a blog article about it. And so my understanding of the snake venom thing is that the spike protein has some homology or some similarities to proteins that are found in snake venom. Okay, and there was this researcher who was, going into this, and his research hasn't been published, and he was shot. He was killed apparently very early on during the pandemic. So that's extremely, upsetting and suspicious, right? Um, but certainly, I mean, maybe this thing was created in a lab. I'm basically convinced of that. And whether they, got a protein from snake venom and used that to help create the spike protein or not, that's up for debate. Certainly is certainly possible. The other issue here was that snake venom, one of the ways it kills you, like the primary way it kills you, is by thinning your blood, right? So you bleed out and you die. We don't usually see that with COVID a lot, right? We see a lot of micro clotting. So not sure that the spike protein is really causing that. But another aspect of this, Watch the Water documentary was that remdesivir does slow down clotting or blood, thin your blood. So, that's kind of suspicious, I guess. It increases your prothrombin time. And, but these two things, I don't know that drawing the parallel between. So, regardless, if the spike protein came from snake venom, I mean, maybe it doesn't cause the same things that snake venom does, but that doesn't prove that it doesn't come from snake venom. What else was there in there? The monoclonal antibodies. So the other kind of clue that Dr. Artis had was that polyclonal antibodies are used for snake venom. So antivenom is actually antibodies to the snake venom. And so monoclonal antibodies, which is just like a different kind of antibody to COVID-19, he initially suspected were dangerous, but then he was like, this is really effective and the government's not really encouraging it, and so that's suspicious. And I agree that that was very suspicious that they only encouraged remdesivir. Really, they kind of poo-pooed everything else until Paxlovid and these other things came along, which have very little data for them, and are, have some serious red flags around them also. So that's my understanding of the snake venom thing. I'm not sure like how that helps us really, other than monoclonal antibodies are probably always good. If you're okay with the way that they're made, using fetal cells, I think. But a lot of medications are used that are made that way. Um, so let's see. Let me know if there was anything else about this snake venom thing that I missed. I think I kind of lost track of where was the snake venom comment. Okay, here we go. Um, I'm pregnant. Okay. I somewhere around it. Yeah, for inflammation, high dose omega-3 helps. Yes. Yeah. So the other thing I've found with high dose omega-3 is that if you start too high, then it can upset your stomach. You can have diarrhea. You can have some nausea and stuff. So start a little bit lower and work your way up. Jenny Lydell, I'm pregnant with long COVID. There's no information about what's available for pregnant women. What do you recommend? So yeah, so I would. So ivermectin can be used. I would typically avoid it. Low dose steroids might be possible for a pregnant woman. I would also hesitate with that. I mean, honestly, if it's not terrible, I might just wait until the pregnancy's over. Yeah, it's a tough thing to answer without knowing all the details, right? So like, at the same time, you would be concerned about the baby and the inflammation and stuff like that. I don't think that would be a terrible concern if the inflammation is not too bad. Yeah, that's a tough kind of question to answer. I would definitely start with the simplest things, which is the diet, the exercise, some of the over-the-counter supplements. Make sure that the supplements are okay with your GYN. I know that maybe turmeric and some of those things might be an issue with pregnancy also, so you want to be sure you're not taking any. So it's pregnancy is complicated. So you got to talk to somebody and give them the whole history first. But simple things like a low histamine diet wouldn't be an issue with pregnancy, and vitamins, and maybe maybe fasting, would certainly not be an issue. And if those things help, then you don't really need to go any further. And maybe you can wait if you can suppress your symptoms enough. Maybe you can wait until after the pregnancy to try all the medications. Um, I know HCQ has been used in pregnancy also, so I don't have a lot of experience with long COVID and HCQ, but that might be another option. Paul Cronin, thank you for all you're doing. You're welcome. Ivermectin extremely overpriced as a person that's showing long haul COVID symptoms. Yeah, so there are high priced places to get ivermectin and low cost places to get them. Um, and the lowest one may be horse-based. A lot of people just end up using horse-based. But we do have some really cheap pharmacies that send it through the mail. So I think most people can afford ivermectin if they need it. I'm going to try to catch up with the rest of the questions, but I may not be able to. um, so we might have to wait for the next video. But thank you everyone for showing up. This was so much fun for me, and I will look forward to doing it again. Leave some comments about what you would like me to talk about next, and please like and subscribe the video, and or subscribe to the channel, and share this with everyone that you know, and even repost it if you can, because I don't even know how to do that yet. So if you can repost it to like Rumble or something, that would be great in case it gets taken down. Um, Thank you so much, everyone, and I will put the links in the description for the things I talked about if I can remember them. And just again, any comments for questions or things that you want to for me to talk about next time. All right, thank you, everyone. All right, bye bye.